Have you ever woken up in the middle of the night with your hand completely numb, unable to move your fingers, barely able to feel anything? Or maybe you're sitting at your desk and suddenly your feet start tingling for no apparent reason. So that strange, uncomfortable sensation, the feeling that your limbs have fallen asleep, even when there's nothing pressing on them, has a medical name, paresthesia. And while it might seem harmless in the moment, paresthesia can sometimes be your body's first warning that something much more serious is quietly happening beneath the surface. In this video, we're going to break down everything you need to know about this symptom, what causes it, when it's harmless, and when it's a sign that silent nerve damage is already spreading through your body. What is paresthesia? Let's start with the basics. Paresthesia is the medical term for that tingling, numbness, or pins and needles sensation that occurs without any external stimulus, meaning nothing is touching you, nothing is pressing on you, and yet you feel it anyway. Sometimes it's described as a burning feeling, a crawling under the skin, or a strange sleepiness in the hands or feet. A broader term, dysesthesia, includes similar abnormal sensations that can also be triggered by contact with something, and even a light touch that shouldn't hurt. These sensations are extremely common. Almost everyone has experienced the classic hand fell asleep moment. But when they start happening frequently, without obvious cause, or in combination with other symptoms, that's when paresthesia becomes a serious signal you shouldn't ignore. The nervous system and why nerves go silent. To understand why paresthesia happens, you need to understand the basic role of your peripheral nervous system. So your brain and spinal cord make up the central nervous system. Everything branching out from there, the nerves running through your arms, legs, hands and feet, is the peripheral nervous system, and these nerves carry signals in both directions, movement signals from your brain into your muscles, and sensory signals from your skin and tissues back to your brain. When something interferes with those signals, whether it's physical compression, inflammation, chemical imbalance, or structural damage, then the nerve misfires. Instead of sending a clean signal, it sends erratic, distorted impulses. Your brain interprets these as tingling or numbness. That's paresthesia. So what makes this dangerous is that in many conditions, nerve damage begins silently and gradually. The tingling starts mild and intermittent, and people dismiss it, but under the surface the nerve may be slowly deteriorating. And by the time pain, weakness or paralysis sets in, the damage can already be advanced. The most common causes, and the ones you might overlook. There are dozens of causes of paresthesia, ranging from completely benign to life-threatening. Let's go through them. To physical compression and nerve entrapment are among the most frequent causes. Carpal tunnel syndrome is probably the most well-known. It involves compression of the median nerve at the wrist, and typically produces tingling in the thumb, index and middle fingers. People who do repetitive hand and wrist movements, manual labourers, cleaners, athletes, are particularly vulnerable. There's also Guyon syndrome, which involves compression of the ulnar nerve, and typically causing tingling in the ring and little fingers. And brachial plexus injuries, involving the network of nerves running from the spinal cord through the shoulder and down the arm, can occur in workplace accidents or car crashes, leading to paresthesia throughout the entire arm. Poor posture is another surprisingly common trigger. Sitting with crossed legs, leaning on an elbow for too long, or sleeping with your arm in an awkward position can compress a superficial nerve long enough to trigger numbness and tingling. In most cases, moving and stretching restores normal sensation within minutes. But if this happens regularly due to occupational habits, what starts as a temporary inconvenience can evolve into chronic nerve entrapment. Spinal problems are a major cause that people often don't connect to their tingling hands or feet. A herniated disc where the cushioning material between vertebrae slips out of place, can press directly against a spinal nerve root. In the lumbar region, this is what causes sciatica, shooting pain and paresthesia down the leg. In the cervical spine, a herniated disc at the C6 level can mimic the exact same symptoms as carpal tunnel syndrome, tingling in the first two fingers, which is why careful diagnosis is so important. And the location of paresthesia in the hand or arm can actually help pinpoint exactly which spinal level or nerve is affected. When your body's chemistry is causing the problem, not all paresthesia comes from physical nerve. Compression. Sometimes the problem is biochemical. Vitamin deficiencies are a major and often underdiagnosed cause. Vitamin B12, B1, B6 and folic acid, B9, are all critical for healthy nerve function. When levels drop too low, nerves begin to misfire. B12 deficiency in particular can cause progressive neurological damage, and paresthesia in the hands and feet is often one of the earliest signs. The frightening part is that B12 deficiency can develop slowly over years, often without obvious dietary explanation, especially in older adults or people on certain medications. Anxiety and hyperventilation can also produce sudden, intense paresthesia, including tingling around the mouth and face. When a person breathes too fast due to panic or extreme stress, carbon dioxide levels in the blood drop rapidly. This shifts the blood's pH, which directly affects nerve excitability. The result can be widespread tingling, and in severe cases involuntary muscle cramping, particularly the characteristic claw hand posture seen in sort of severe hyperventilation episodes. Treatment is simple. Slow the breathing, and sometimes breathe into a cupped bag to restore CO2 balance. Chronic diseases represent some of the most serious long-term causes of paresthesia. Diabetes is perhaps the most significant. Uncontrolled blood sugar damages the small blood vessels that feed peripheral nerves, leading to diabetic peripheral neuropathy. The feet are typically affected first, that persistent numbness or tingling that starts at the toes and gradually moves up. Without management, this neuropathy can become severe and irreversible. Hypothyroidism, underactive thyroid, is another condition that can mimic or worsen carpal tunnel-like symptoms, which is why thyroid function is always checked when nerve entrapment is suspected. Multiple sclerosis is a neurological disease where the immune system attacks the myelin sheath, the protective coating around nerve fibers, causing disrupted nerve signals throughout the body. Paresthesia is frequently one of the early symptoms, sometimes appearing on one side of the body, sometimes both, often coming and going unpredictably. Other serious conditions like amyloidosis, Raynaud's syndrome, where blood vessels in the hands and feet go into spasm in response to cold or stress. And vasculitis can also present with paresthesia as an early warning sign. Medications, toxins, and infections. It's not just disease from within. What enters your body from outside can also damage your nerves. Several medications are known to cause paresthesia as a side effect. Chemotherapy drugs used in cancer treatment frequently cause peripheral neuropathy. Antiretroviral medications used for HIV can also trigger nerve symptoms. Even common anticonvulsant medications like carbamazepine, topiramate, and phenytoin can produce these sensations in some individuals. Toxic substances are another underappreciated cause. Chronic alcohol use damages peripheral nerves over time. Alcoholic neuropathy produces paresthesia, most often in the feet and legs. Tobacco, through its vascular effects, can restrict blood flow to nerves. Heavy metal poisoning from lead exposure in particular can cause nerve damage leading to tingling and numbness. And bites or stings from certain animals, snakes, spiders, ticks, can directly affect the nervous system and trigger paresthesia. Infections can trigger nerve symptoms as well. Shingles, reactivation of the chickenpox virus in adults, travels along nerve pathways, often causing burning pain and paresthesia before the characteristic skin blisters even appear. HIV itself can cause nerve damage. Lyme disease, transmitted by tick bites, is notorious for producing neurological symptoms, including paresthesia. Syphilis in its later stages can affect the nervous system extensively. Even leprosy, still present in parts of the world, primarily damages peripheral nerves, causing loss of sensation rather than tingling. The serious warning signs: heart, brain, and beyond. This is where paresthesia moves from uncomfortable nuisance to potential emergency. A stroke, whether caused by a blocked blood vessel or a bleed in the brain, can begin with sudden numbness or tingling on one side of the body. The key here is that it will almost always be accompanied by other symptoms: weakness or paralysis on one side, difficulty speaking, sudden vision changes or confusion. If paresthesia appears alongside any of these symptoms, this is a medical emergency requiring immediate attention. Your heart attack and angina can radiate pain and numbness down the left arm. Sometimes this numbness or tingling is the sensation people notice first, before the chest pain even begins. Again, context matters enormously here. Peripheral arterial disease, blockage of an artery in a limb, can also initially present with paresthesia before progressing to severe pain. Deep. As vein thrombosis, a blood clot in a vein, typically causes swelling and pain. But paresthesia can precede those classic signs. Kidney disease, by disrupting electrolyte balance, sodium, potassium and calcium levels, can trigger widespread paresthesia, and in severe cases muscle spasms and cramps. Even migraine and epilepsy can involve paresthesia. Some people experience tingling as part of the aura phase before a migraine headache. In certain types of epileptic seizures, the episode begins with a spreading sensation of paresthesia before any convulsion occurs. Cancer, while typically not a first-line explanation for paresthesia, can cause it through tumours pressing on nerves, spinal cord compression from metastases, or through what are called paraneoplastic syndromes, where substances released by a tumour affect nerve function even at a distance. When to see a doctor, and what the diagnosis involves. So how do you know when to act? The rule is relatively simple. If your hand falls asleep because you leaned on it and the sensation resolves within minutes of changing position, there's nothing to worry about. But if paresthesia is frequent, persistent, worsening over time, or appears without any obvious cause, you need medical evaluation. Seek urgent care immediately if the tingling comes alongside weakness or paralysis, sudden difficulty speaking or understanding language, vision changes, confusion, signs of stroke, or severe chest pain. Diagnosis starts with detailed medical history and physical examination, which direction the tingling travels, whether it's one side or both, what makes it better or worse, what other symptoms accompany it. So from there, blood tests can check thyroid function, B12 and other vitamin levels, blood glucose, kidney function, and electrolytes. An electromyogram, EMG, is used to measure the electrical activity of nerves and muscles, helping to identify entrapment syndromes like carpal tunnel. MRI may be ordered if a herniated disc or spinal cord problem is suspected. Additional imaging or neurological testing follows based on the clinical picture. Treatment. It starts with finding the root cause. There is no single treatment for paresthesia because it's a symptom, not a disease. The treatment depends entirely on the underlying cause. Carpal tunnel syndrome may be managed with a wrist splint and anti-inflammatory medication. If symptoms don't improve, a minor surgical procedure can relieve the compression. Herniated discs are evaluated on a case-by-case basis. Many resolve with conservative care, others may require intervention. Vitamin deficiencies are corrected through supplementation. Diabetes requires tight blood sugar control to slow or prevent further nerve damage. Thyroid disorders are corrected with hormone therapy. Anxiety-related hyperventilation responds to breathing techniques and stress management. Ear infections are treated with the appropriate antimicrobial therapy. The message is clear. The earlier you identify what's causing the paresthesia, the better your chances of stopping the damage before it becomes permanent. Closing. Paresthesia is one of those symptoms that's easy to dismiss, and a brief inconvenience, a minor annoyance, something that goes away on its own, and often it does. But the nervous system is not a system that repairs itself easily. Silent nerve damage, once established, can spread gradually, and by the time pain, weakness, or paralysis makes the problem undeniable, the window for the most effective intervention may have already closed. Your nervous system is constantly sending you signals. Paresthesia is one of those signals. Don't ignore it. If this video helped you understand something important about your body, share it with someone who needs to hear it. And if you've been experiencing unexplained tingling or numbness, talk to a healthcare professional. It could be nothing, or it could be the earliest warning you're going to get.